It is also important to conduct such tests in the working environment to assess and classify the contamination of sites with asbestos. It should also be evaluated to assess the extent of damage resulting from chronic exposure. To evaluate employee exposure to toxic substance in the construction industry, several techniques can be utilized. Personal air monitoring. This involves collecting air samples from the worker's breathing zone to measure the concentration of airborne contaminants. This provides a direct measurement of the individual's exposure. Biological monitoring. Analysis of blood, urine, or other biological samples can detect the presence and levels of the toxic substance or their metabolites in the body, indicating actual absorption of the contaminants. Surface wipe sampling. Collecting samples from work surfaces, equipment, and other areas can help identify the presence and extent of surface contamination, which may contribute to worker exposures. Visual inspection and job observation. Carefully observing work practices, material handling, and the overall work environment can provide valuable insights into potential exposure routes and risk factors. Combining these various exposure assessment techniques allows for a comprehensive evaluation of worker exposure and identifies areas needing improvement to reduce risk. There is no debate that construction work involves toxicant exposures that are reliably evident by increases in a variety of health outcomes. Anecdotal claims might suggest that working customarily in a traffic-soaked, grimy, dusty work environment is harmful. However, comparative information can elevate this concern to harm to that of a fundamental cause. A minimal subset of the list of diseases that a range of construction worker toxicants may cause includes chronic obstructive pulmonary disease, silicosis, interstitial lung disease, lung cancer, renal disease, reproductive outcomes, mental health outcomes, cardiovascular outcomes, and various other concerns. Most notably concerning is the health impact of inhaled toxicants. Ozone, nitrogen dioxide, sulfur dioxide, formaldehyde, and respiratory particles are 5 of the top 6 pollutants noted to be most generally harmful to our health and are frequently present on a construction site in large quantities. Occupations directly involved in construction, such as cutting, grinding, drilling, hammering, jackhammering, polishing stone, mixing, rendering, hand tiling, and timber processing, often result in unwarranted daily inhalation of dust and gases that can cause these medical conditions. Prolonged exposure at lower concentration accumulates to considerably higher exposures. The non-respiratory impacts of below-tip toxicants from injuries caused by construction work are also noteworthy. Some conditions such as body-wide contact dermatitis, irritation of the nose and throat, and corneal burns may be readily self-diagnosed. In contrast, others such as elevated blood pressure may only be revealed with regular physical screenings. Given the toxicity of handling combinations of physical, chemical, and biological agents, healthcare providers and public health workers must better understand the plethora of health outcomes experienced in identifying high-risk cases. As a result, correctly interpreting and adhering to policies can also save governmental resources through the elimination of unwarranted treatment of individuals suffering from non-construction related injuries and protect workers from excessive exposure to bodily harm during practice. Harm can be simultaneously assessed in terms of the body's burden of such contaminants, almost all of which are across the placental barrier, and in the child in terms of neurodevelopment, physical, congenital, and other outcomes. It is vital for any person engaged in the practice or policy of construction to recognize the extent of toxicity to be better protected. This is an all-encompassing disease. We need to have the healthcare workers, not just respiratory physicians, but general practitioners, radiological professionals, and oncologists understand that occupational exposure causes this. This can only occur when the disease is identified broadly and the exposure symptoms causing it are detailed and disseminated. One of the significant reasons for focusing on respiratory issues related to reported exposures and effects is that they constitute up to 50% of the workforce with reported long-term health effects. Respiratory illness issues like irritation, allergies, asthma can be minor, with only temporary symptoms occurring in some workers. However, bad enough exposure and time may lead to significant problems such as permanent asthma, chronic obstructive pulmonary disease, and even lung cancer many years later. The big problems with these kinds of long-lasting health effects are that there is no reliable cure for them. Even with the use of drugs and the financial cost of years of health care may continue to increase, often leaving the affected workers with lifelong debilitating problems. Some of the most common toxicants for these long-lasting health problems are widely used in construction. Worker exposures may be high for specific construction tasks, such as working with quartz, which contains many of the toxic effects of these traditional materials, and exacerbation in the effects of some of these toxicants is caused by cigarette smoking or other toxic exposures. Protective measures are essential to prevent exposures, and regular health checks of these workers are needed mainly to identify when an asthmatic reaction or other respiratory issue becomes noticeably early to avoid long-term consequences of these work-related exposures. We have examined articles and statistics reporting levels of human exposures to metals and volatile toxicants in and around construction sites. Here we recognize personnel, environmental, and occupational risk factors associated with the generation and temporal persistence of toxic exposure in construction environments encountered on the job. Personal risk factors include variety, intensity, nature of work, and behaviors related to eating, drinking, and smoking. Environmental risk factors include lack of ventilation, confined spaces, demolition and cleanup events, and atmospheric conditions beyond the control of the construction team. Occupational risk factors include employer priorities and policies regarding occupational and environmental health and safety, worker training regarding specific toxic exposures, distribution and wear of respiratory protective equipment, and barriers to accessing regulatory or company-mandated personal protective equipment that does not fit. Environmental, personal, and occupational factors determine worksite risks for toxicant exposures on construction sites. Here, the extent of personal protection is not determined by managerial or policy goals or negative enforcement. Persons working in non-unionized settings may not have access to personal protective equipment or receive regulatory or company assistance to guide them through complex regulatory requirements. Job site risk factors are modulated further by obedience to or failure to enforce occupational and environmental health and safety laws concerning regulatory limits, industrial hygiene sampling, and exposure characterization, and any limits enforcement by employers. Personal hygiene and worker protective behavior are equally crucial for decreasing the risk of exposure. These risk factors constitute a framework for developing industry recommendations on minimizing exposure to breathable toxicants. One long-term approach that can help prevent and reduce the risk of human toxicants in the construction industry is educating and training workers about exposure to toxicants so that they are aware of the risks. Workers need to be made aware that exposure to many toxicants may not always result in immediate adverse health effects, but that there are long-term health effects that may emerge years after their exposure. Employers must provide employees with appropriate personal protective equipment and establish engineering controls and administrative measures to help protect workers from any physical or health hazards on construction job sites. Employers must have a robust safety program and protocols for the site to protect the workers through preemptive and reactive measures. An emergency protocol should be outlined for on-the-job and off-the-job medical and fire-related emergencies to protect the crew further. Regular inspections of equipment, facilities, sites, and environment is necessary to reduce the risk of adverse health effects from machinery, trade work, or physical environment. It is also imperative to have regular maintenance performed on the sites, buildings, and equipment that can become areas of defect, damage, construction modification, repair, and so forth to mitigate the potential for exposure. Coordination with property management to find out about past events that have taken place in the vicinity of the sites is crucial to prevent accidental contamination. A cleaning protocol should be quick and periodic and consist of dry cleaning and proper disposal of waste. Further, the construction industry must prioritize exposure prevention at all levels of the industry and incorporate safety as an aspect of utility that begins with a site's priority. Safety must be treated as a crucial foundation rather than an accidental fragment of a project budget and approval. Workers in the construction industry often lack access to occupational health services, and employers have traditionally focused more on acute hazards rather than chronic health effects. This has led to high rates of occupational diseases among construction workers, particularly in areas such as noise-induced hearing loss, which is an entirely preventable condition, exposure to carcinogens, toxic chemicals, and other hazardous substances, can have severe consequences ranging from respiratory issues to cancer. Hopefully, the educational presentation on the risks of human toxicants in the construction industry will help you make better informed decisions about your safety and health.